In this video, the clinical user will learn how to document an individual treatment session using ACE's progress note. The purpose of the progress note in ACE is to provide accurate documentation of a clinical service that is delivered to a patient and billed to a funding source for a specific date of service. You are going to love ACE's progress note. Documentation of a treatment session is only initiated from the user's schedule. Therefore, the user should confirm the day that the treatment session was delivered on the schedule. Tap on the scheduled appointment. The action form will appear, and the user will tap the Document button. This form allows the user to confirm the date of service. The date of the scheduled treatment session appears in both text format and on an inactive calendar. If the visit did not occur on this date, the user will need to exit the progress note and reschedule the appointment on the correct service date utilizing the ACE schedule. It's much easier to confirm the date of the treatment on the schedule prior to documenting the session. If the service date is correct, the user may tap the Continue button. The user will next identify the place of service type as one patient site or 2+ patient site. A one patient site would be a site at which only one patient was seen, such as a home. A 2+ patient site would be a site at which 2 or more patients were seen, such as a daycare or clinic. The user can also choose Missed Visit to document the treatment session that did not occur. We'll talk more about that later. The user will next identify the place of service location. Each patient will have a primary place of service listed in the ACE application. This address will appear on the Primary button. If the treatment session occurred in a different location other than the primary site, the user will tap Other, and a pop-up box will appear where the user can choose the location from a drop-down list of previous service locations, or enter an entirely new service location. The user will identify the type of service provided. This choice will identify the CPT code to be used to bill the service. The program will only allow the user to select therapy that has been recommended on the patient's evaluation and plan of care. Other options will be unavailable for selection. As the user provides answers in ACE about the treatment session, notice that the information cumulatively builds on the top half of the form. This information identifies the place of service name and address, place of service type, and the type of service that will be entered after the user taps Continue. The user will next be asked to identify if this was a makeup visit. When Yes is tapped, a drop-down list will appear with a list of available dates that were missed within the last 30 days. This is another compliance feature in ACE that assists the clinical user in providing and billing for makeup sessions that fall within the guidelines for makeup visits. ACE will next display the short-term goals from the patient's current plan of care. The user will tap the appropriate boxes to identify the goals addressed during the treatment session. Tap Continue. ACE will automatically display the skilled interventions from the current plan of care for the patient. The user will tap the box for the actual skilled interventions used during the treatment session. Tap Continue. ACE will display both the short-term goals and skilled interventions as a reference for the clinical user, but they do not appear on the printed documentation. The clinical user will then document their treatment note in SOAP note fashion carefully narrating the relevant information and data from the session. The question mark is a help button with information about writing documentation in SOAP note format. When the SOAP note is complete, review it for accuracy, and then tap Continue. The user next enters the duration of the visit in minutes. The user will next preview the progress note documentation, and then tap Sign Progress Note. Notice that the progress note attestation states that by your signature, you attest that the services delivered and documented are clinically appropriate, medically necessary, and required the intervention of a licensed speech-language pathologist. All coding is an accurate reflection of the service delivered and can be billed as reported. The user may next tap Yes, Sign Progress Note. ACE alerts the user that the document has been filed in the EMR, and the appointment changes from red to yellow on the schedule. Remember, a yellow appointment is documented but unsynced. It requires your further attention. Sync your device. After a successful sync is performed, the appointment will change from yellow to green, a documented and synced appointment. Typically, ACE users report that it takes between 4 to 9 minutes to complete documentation of a treatment session. As a user's familiarity with ACE increases, the time typically decreases dramatically. This concludes the progress note instructions for ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written clinical ACE manual for detailed instructions and screenshots related to specific features and tasks.